Facepalm, USA. Facepalm America. I'm Beowulf Rockland, facepalmamerica.com. I've talked to you many times on this program about the system referred to as Medicare Advantage. And I didn't invent it. It was actually Tom Hartman who came up with the phrase Medicare Disadvantage, at least to the best of my knowledge. That's the first place that I heard it. And I think he's absolutely right. And I've told you before on this show that I have had loved ones that have been robbed of medical care that they were entitled to because a private insurance company that was part of Medicare Disadvantage took what my loved one was entitled to and decided not to give it to them because they wanted to make a profit. Under Medicare Advantage, these private insurance companies manage, quote unquote, Medicare, and so they get the money from Medicare via us, the taxpayers, and they run the systems of care. And they're private companies. And their prime directive is to make money. And how do they do that in a situation such as I've outlined? They cut back on benefits. And that's what happened to one of my relatives. It's enraging. It's disgusting. And Medicare Disadvantage should be dismantled. Another way that they make money through Medicare Disadvantage, aside from denying benefits that are outlined in Medicare under their rules, is by billing things which shouldn't be billed for and running up the bill for you and me, the taxpayers of the United States of America. And I don't always agree with things that the Wall Street Journal has to say, but they have done a remarkable piece of investigative reporting in a story that is entitled, Insurers Pocketed $50 billion from Medicare for Diseases No Doctor Treated. You can do a search for that story on the search engine of your choice. I'm going to read parts of it here, but you should go and read that story in its entirety. Again, insurers pocketed $50 billion from Medicare for diseases no doctor treated. From the Wall Street Journal. Private insurers involved in the government's Medicare Disadvantage program. I don't even want to say Medicare Advantage. That's the word that's printed. But it's Medicare Disadvantage, and I'm going to say it that way. Private insurers involved in the government's Medicare Disadvantage program made hundreds of thousands of questionable diagnoses that triggered extra taxpayer-funded payments from 2018 to 2021, a Wall Street Journal analysis of billions of Medicare records found. The questionable diagnoses included some for potentially deadly illnesses such as AIDS, for which patients have received no subsequent care, and for conditions people couldn't possibly have, the analysis showed. Often, neither the patients nor their doctors had any idea. So these private insurers are billing the government for diseases and conditions which don't exist to pad their profits. They're stealing from people who are on Medicare. They're stealing from senior citizens. They're stealing from you and me, the taxpayer. That's what's happening. Medicare Disadvantage, the $450 billion a year system in which private insurers oversee Medicare benefits, grew out of the idea that the private sector could provide health care more economically. What a quaint idea. What a quaint idea. That's nonsense. Anytime you hear someone say, well, a business could do it more economically, reach for your wallet. Hold on to your wallet, because you're about to get robbed. The only principle that businesses run on, and they're not necessarily bad things, if they're properly, regulated and they don't become too large. But the prime directive of a business is to make money. That's what they're there for. That's what they do. It's not to save the taxpayers money. It's to give its shareholders money. That's the point of a business. Medicare disadvantage has swelled over the last 2 decades to cover more than half of the 67 million seniors and disabled people on Medicare. Instead of saving taxpayers money, Medicare disadvantage has added tens of billions of dollars in costs, researchers and some government officials have said. One reason is that insurers can add diagnoses to ones that patients' own doctors submit. Did you hear that? Insurers can add diagnoses to ones that patients' own doctors submit. So they can just add whatever they want. They're not the doctors. They're not seeing the patients. They've never seen the patients. They're just looking at the charts. They have no relationship with them. And yet they can add stuff to the bill. That's nuts. Now, Medicare gave insurers that option so they could catch conditions that doctors neglected to record. They're not in a position to know. They're not the doctor. Many diagnoses were added for which patients received no treatment or that contradicted their doctor's views, because they don't really care about you. They don't care what the doctor says. They just want to make more money. They just want to make more money. The insurers make new diagnoses after reviewing medical charts, sometimes using artificial intelligence, and sending nurses to visit patients in their homes. They pay doctors for access to patient records and reward patients who agree to home visits with gift cards and other financial benefits. Insurers added diabetic cataract diagnoses to 148 patients treated by Dr. Howard Chen, an ophthalmologist in Goodyear, Arizona. He said he saw at most 1 or 2 such cases a year. So they're just adding fake stuff and billing you and me, the taxpayer, for it. He said charges insurers $40 per patient. He said he charges insurers $40 per patient to cover his costs for providing them with medical charts. If they're just making stuff up, then what do they even want or need with my charts? Said Chen. That's a darn good question. In all, Medicare paid insurers about $50 billion for diagnoses added by insurers in the 3 years ending in 2021, the journal's analysis showed. Some diagnoses claimed by insurers were demonstrably false because the conditions already had been cured. More than 66,000 Medicare disadvantaged patients were diagnosed with diabetic cataracts, even though they already had gotten cataract surgery, which replaces the damaged lens of an eye with a plastic insert. They're just making stuff up because they want the money. They're stealing from you. They're stealing from the elderly. They're stealing from the disabled. That's what these companies are doing. That's what Medicare disadvantage allows them to do. Another 36,000 diabetic cataract patients didn't receive any medical services or prescription drugs related to diabetes. About 18,000 Medicare disadvantage recipients had insurer-driven diagnoses of HIV, the virus that causes AIDS, but weren't receiving treatment for the virus from doctors between 2018 and 2021. Each HIV diagnosis generates about $3,000 a year in added payments to insurers. Let's see, that's 18,000. So we're talking about just that one set of bogus billings alone is what? $54 million to insurance companies that they aren't owed. Just in that one instance. Insurer-driven diagnoses by United Health for diseases that no doctor treated generated $8.7 billion in 2021 payments to the company, the journal's analysis showed. United Health's net income that year was about $17 billion. They are stealing from you. They are stealing from us. When Congress conceived of the Medicare Disadvantage program decades ago, the hope was that insurers would make Medicare more efficient. My God, these people live in cloud cuckoo land. In traditional Medicare, doctors and hospitals get paid for each service they provide, an incentive to provide more. The idea behind Medicare at Disadvantage was to pay private insurers in a lump sum to cover all services, giving them an incentive to keep their patients healthier. The only thing it gave them an incentive to do was to overbill and steal from us. To protect insurers from the risk of winding up with sicker than average patients, we got to protect them. We got to protect the insurers. These massive companies that make billions of dollars. The government allowed bigger payments for certain serious health conditions. Partly because of that, Medicare Disadvantage has cost the government an extra $591 billion, over $500 billion in the past 18 years, compared with what Medicare would have cost without the help of the private plans, according to a March report by the Medicare Payment Advisory Commission. So, an extra $500 billion, over $500 billion more than it would have cost if the government had done it themselves. Don't let people tell you, well, we ought to run the government like a business. This is what happens. This is what happens. They steal from you. Adjusted for inflation, by the way, that amounts to $4,300 per U.S. tax filer. Can you afford that? Can you afford an extra $4,300 to give to a giant health insurance company? Academic researchers and government investigators have raised questions about high rates of insurer-driven diagnoses in Medicare Disadvantage. In a 2021 report, the Inspector General that oversees Medicare found the agency spent billions of dollars based on insurer-driven diagnoses for which patients received, of course, no care from doctors. In a 2019 whistleblower lawsuit by a Florida doctor, it was alleged that an insurer submitted inaccurate diagnoses, including a Medicare Disadvantage patient's foot had been amputated when it wasn't. This is what we have to stop. In September, insurer Cigna Group agreed to pay $172 million to settle fraud allegations by the Justice Department. They weren't put in jail. They weren't kicked out of the Medicare Disadvantage program. They just had to pay $172 million, which to you and me is an enormous amount of money. But compared to the billions as opposed to millions of dollars that they're making from this is chump change. End Medicare Disadvantage now. That's what I have to say. And again, the name of the story, if you want to read the full story, is Insurers Pocketed $50 billion from Medicare for Diseases No Doctor Treated. That's from the Wall Street Journal. Thank you for listening today. I'm Beowulf Rockland. This is Facepalm America. You can go to facepalmamerica.com for more information and to listen to past episodes. Thank you for being here. And until next time, enjoy the day.
The John Fugelsang podcast is now available 6 times a week with me, John Fugelsang. I've been murdered on CSI, picketed by Westboro Baptist Church, and host Tell Me Everything on SiriusXM Progress 127. You will hear authors, politicians, actors, filmmakers, rappers, rock stars, journalists, activists, unhinged callers, and way too many comedians. They all have a place on the John Fugelsang podcast, and so do you. The John Fugelsang podcast, fair and biased. Find it on Apple Podcasts,